Hi, I'm Mark Bunso. I'm Director of Corporate Communication and Social Media for Johnson & Johnson.
Hi, I'm Amy Cowan, and I'm the Head of Industry for Healthcare at Google.
My name's Alex Butler, work as a Digital Strategy and Social Media Manager for Janssen in the UK.
Hi, I'm Ray Chapsik. I'm the Commissioner of Pharmaceutical Advertising Advisory Board in Canada, alias PAB.
My name is Figen Şamdancı. I'm Corporate Communications Manager in Pfizer Turkey.
One of the things that I think we're facing still as organizations is that we need to start to better understand what consumers and what people, and I shouldn't use the word consumers, but that's the term that we all understand, but that people who are seeking information online about health are looking for, and to be able to start to respond and to engage with them on their terms to help them make informed health decisions.
Research has really become an important step in the patient pathway, in that there's no longer just this one-way communication where companies are pushing messages at consumers and then their only option for information is through the healthcare professional, but rather consumers now are much more empowered to go online and actually use the internet to actually give them access to information at multiple different touch points along the patient journey.
Whether we're prepared to kind of serve our communities as opposed to serve them in a way that is best for them, or whether we still want to just push our own agenda and our own message on people.
Marketing is not so much a push. Marketing is the past, it's a pull, and they have to really adjust their thinking to be able to make use of social media in a positive way. I'm
excited massively by the opportunity that we have to try and build different relationships with people. I'm thinking, about a more unmediated interaction with the public and with patients. I think that'd be so valuable for us to understand in real time what people like, what they don't like.
I think pharma has to learn to partner. They're not going to be in the driver's seat. And this media doesn't allow them to be in the driver's seat, because if people don't want to be there, there'll be nobody there. So they have to understand that and adjust the marketing thinking right from the top.
I actually think that the empowered e-patient is going to continue to be a pioneer in sort of driving the change here. We've seen a number of these influencers become very well read, very influential in this space. They're driving a lot of the dialogue. They're forcing us to start to look at them as people that we should be forming relationships as institutions. And so I don't think it's any one company. I think it's going to once again be the e-patient that's going to help to start to make the difference.
Patients will be much more important in our life, in healthcare system.
When you think about what patients are looking for around certain disease categories, it's really giving a window into what consumers care about, all the way down to a very specific local level, and information obviously can have a very powerful role in helping shape the way these products are developed in the future.
As an industry, we seem to be moving beyond the why and have now moved to, and even moved in some ways beyond the how. It's now becoming a place where we're starting to really talk about the implications of it. And I think that's something that is very reassuring, that we're starting to get ourselves to a place as an industry, or where I think we're going to be able to engage in a much more effective way. The other thing that really struck me is that the conversation has also moved beyond just social media, and I think that's essential. Social media in itself is not, in and of itself, is not a strategy.
I've said social media doesn't exist. I don't think mobile should exist either, in the sense that I don't think, I'm going to go mobile now when I use my iPad. I just want to access the information in the best way possible for the situation I'm in.
Pharma has a chance, through the use of social media, by the nature of it, to build more trust, to get in, and building the trust by focusing on health and wellness of patients.
We talk about building trust, we consistently talk about building trust and don't do that much to actually try and address that. And that's because it takes a long time. And I think that the big challenge that is starting to build those unmediated relationships with the general public, starting to have a customer service focus, trying to delight the customer, you know, which I suppose is quite an American phrase, but you know, if you truly believe in that, it does inform a lot that you do.
I believe in people. I believe in organizations who develop their human resources, and also organizations who put effort behind the digital world to reach their stakeholders.